Hi, I'm Dr. Cameron Keeney with the Center for Sleep Apnea and TMJ. So there are multiple treatments for sleep apnea, obstructive sleep apnea. One of the most important ones would be CPAP. It's kind of the gold standard. Surgery is another option, but the most important thing that I do at my office is what's called oral appliance therapy. Some people will call this a mouthpiece or a mouth guard. Basically, it's a way of keeping the jaw supported so it doesn't fall backward and close off the airway. I brought a model today to kind of explain what it looks like. This example here is called an EMA, which stands for Elastic Mandibular Advancement. There's multiple different options out there to treat sleep apnea. This is a custom adjustable appliance that we use often, so I'd like to kind of explain how this works. Basically, all oral appliances do the same thing, they just have slightly different ways of doing it. They're trying to keep the jaw from falling backward too far, or in some cases we actually have to pull the lower jaw slightly forward to help open the airway. So this one, for example, the way it works is we have a custom-made trays, upper and lower trays that go on the upper and lower teeth. So the way we do this is we take impressions of the teeth, then a lab will custom make these trays to fit over the teeth. So one tray for the upper teeth and one tray that goes over the lower teeth, just like that. So no mask or machine blowing air at you like a CPAP. The way this one in particular works is these bands on the side are going to keep the jaw from going backwards. So you can see here there's a band that goes from the upper to the lower piece on both sides. So as your lower jaw tries to fall backward, basically you can kind of see that the bands just kind of catch and don't let the jaw fall too far back. Now in some cases that works just fine, in other cases it doesn't. So in the cases where we need to be a little more aggressive with the jaw position, these bands come in different lengths and different flexibilities, so we are able to change these out very easily and bring the jaw forward with different sized bands. Now everybody's different. Everybody has what's called a sweet spot position that tends to work best for them. And again, it's different for everybody. So at first, our goal is subjectively to try to dial this into a position that's correct. So based on how you feel when you wear this, if you feel more rested, have more energy, you sleep deeper or better, snore less, maybe dream more, those would all be signs that this is getting close to your sweet spot position. Now the only way to know for sure which position is the best is a follow-up sleep test. The way we do it at our office is we send you to the sleep lab. They will go ahead and adjust the position of this throughout the night to try to fine-tune it or dial it into the perfect sweet spot position for you. One of the keys to oral appliance therapy treatment is that if we go too far forward, it can actually make the sleep apnea worse. If you'd like to learn more about oral appliances for sleep apnea, please visit our website, sleepidaho.com, or call us at 208-376-3600.